Hello, I'm Dr. David Forstein, a reproductive endocrinologist with the University of South Carolina School of Medicine in Greenville. I'm here to talk to you about APCO Educational Objective number 48, infertility, and we will discuss the definition of infertility and describe the basic causes of male and female infertility. In a second podcast, we will deal with the initial evaluation and management of the infertile couple. Let's start by discussing some basic facts about infertility. First, 15% of couples have infertility. Second, in any given month, 25% of couples that are trying to get pregnant are able to conceive. In 6 months, 60% of couples will be pregnant, and at 12 months, 85% of couples will be pregnant. The 85% of couples who conceive at 1 year gives us the definition of infertility. So the definition of infertility is that there is no conception in 1 year's time. And as we said earlier, that is 15% of the population is affected. We know that age, particularly the age of the woman, has a huge impact on infertility. So we cheat a little bit on that definition so that if the woman in the couple is over 35, we say that they're an infertile couple if they've been unable to conceive in 6 months' time. When we speak of infertility, there's two types of infertility that we discuss: primary and secondary. Primary infertility is for a couple that has never been pregnant. And secondary infertility, they have been pregnant. Now, when you're taking your history, it's really important to ask this question of each member of the couple, because sometimes you find out that he caused a pregnancy in high school or college that she doesn't know about, or she was pregnant in a prior relationship that he doesn't know about. But it changes the focus of your infertility evaluation. Now, of course, there are some things that warrant an earlier infertility evaluation than the 1 year we talked about earlier, or 6 months if the woman is over the age of 35. So, if a couple comes to see you with infertility and she tells you that she has trouble with her menses, so irregular menses, you can assume that she's not getting her period regularly and not ovulating regularly. Ovulatory problems or anovulation are one of the major causes of infertility, and that's not necessarily going to improve over time. Some additional things that would warrant an earlier evaluation is a history of a sexually transmitted disease in either the man or a woman, or any prior pelvic surgery that she might have had, including an appendectomy, because of the risk of scar tissue that could form. Now, as a reproductive endocrinologist, my background is as an obstetrician gynecologist, which means I tend to focus on the woman, but it's important for us to know some basic facts about infertility, and the first thing is that it affects men and women about equally. So typically we say that 40% of the time it's a female factor, and 40% of the time it's a male factor, and 10% of the time it's combined, and 10% of the time it's unexplained. Now, if we specifically look at the causes of female infertility, it falls into a few key areas. The first is ovulation. And ovulation occurs, or ovulatory problems occur in about 30 to 40% of infertile patients. Another 30% of the problem is tubal factor infertility, and tubal factor infertility is responsible or is caused by endometriosis, sexually transmitted diseases, and occasionally congenital problems. The next large group is endometriosis. And estimates of endometriosis causing infertility are anywhere between 13 and 30%. We also believe that many of the couples that have a diagnosis of unexplained infertility are probably underdiagnosed endometriosis cases. So if ovulation is 30 to 40%, and tubal factor is 30%, and endometriosis is somewhere between 15 and 35%, that leaves some very little room for other causes. Now, those other causes could be uterine problems like fibroids or polyps. There can be problems with the cervix. Cervical glands could have been damaged during a LEEP procedure for an abnormal pap smear. But those are the biggest groups. Now, when we think about ovulatory problems, if that's our main heading, we know that there's a number of things that can cause ovulation defects. So, problems with prolactin, thyroid, polycystic ovary syndrome, stress, and under stress we can put down emotional, and physical stress. Physical stress can be things like being a ballerina or a long-distance runner. People who put themselves under those kind of training regimens often have ovulatory problems. Sometimes when we measure hormones, they all seem to look normal, and we're going to go into that in a second podcast on the evaluation and treatment of infertility. Now, male factor infertility typically has one major cause, and that is varicoceles. Varicoceles are responsible for 55% of male infertility, and the remainder of male factor infertility is all due to much smaller things like obstruction of the seminal vesicles or vas deferens, testicular failure, cryptorchidism, and the like. As a preview for the next podcast, the process of working up an infertile couple begins with a detailed history of both the male and the female. The second thing would be a detailed physical exam of the woman, focusing on thyroid, breast, abdomen, pelvic exam, as well as looking at the overall body habitus, because we know that obesity or extreme underweight are problems for ovulation. Male factor infertility is begun after the history with a semen analysis. With these 3 examinations and some basic blood work, we will be well on our way to diagnosing the causes of infertility. Thank you.